Hi, I'm Mel Pickup, Chief Executive of Bradford Teaching Hospitals, and welcome to this week's update, which focuses on our patients. Today we hear from GP Dr Safina Haque about what we can do to stay well this winter. She tells us about the importance of the flu vaccination and, for those who are eligible, a COVID booster jab, as well as the other steps that we can take to ensure good health over the colder season. We also hear from Dr Mayada El-Sheikh, consultant in emergency medicine, about winter vaccinations and why they are important in helping to keep hospital beds free for those most in need over the winter period.
So over the winter months, we may still get the flu viruses and the COVID-19 virus. In most cases, this will be a mild illness. As we know, in the colder months, we spend most of our time indoors. That's why the viruses can spread a lot easily. People who are elderly, who have an immunocompromised system, pregnant and young children, they are therefore at more increased risk of getting these viruses. This does put a lot of pressure on primary care. Most of these winter illnesses can be prevented by boosting your immunity through vaccinations and also by improving self-care. Vaccinations are still the safest way of boosting your immunity, but they also reduce the transmission of illness from one person to another person. We all need to work together to help reduce the spread of winter viruses. This will ultimately help to reduce pressures on primary care and hospital admissions. The winter vaccines are available for adults aged 65 and over. They're also available for anyone from 6 months of age to 64 years of age, but with certain health conditions. Frontline healthcare workers and care home and social care workers are also eligible to have the vaccine. And in addition, we have women who are pregnant or breastfeeding. They can also have the vaccine. Look out for each other, look out for your neighbours, especially your elderly, family and relatives. You can look after yourselves at home. Increase your fluids, wrap up warm, getting medication over the counter, speaking to your local pharmacies as well, and you will get better with good care at home.
So there's a range of things that can cause winter pressures. What we see from an accident and emergency perspective is volume, so a lot more patients requiring high level care, but also respiratory illnesses, so things like asthma attacks and flu can cause a lot of this. And obviously they're requiring a lot more care. When you have a lot of patients, it just means that it kind of overwhelms the system, unfortunately. In the winter, we find that in A&E, it's just full. When you're struggling to find a cubicle to see an unwell patient, it is demoralising. What we love doing in the NHS is providing quality care, and when we can't do that, we struggle. By getting your flu vaccination, you're not just helping yourself, you're helping other people. Something that Bradford Royal Infirmary does really well is trying to get patients to the right place the first time. And we've got a lot of services that provide care in the community. So things like our virtual ward system, and we're able to access that from our emergency departments. So a lot of the time, even if you're feeling generally unwell and feel you need to be in hospital, we can do a lot of this at home. In accidents and emergencies, we're very good at dealing with accidents and emergencies. What I would recommend if you are feeling generally unwell is trying to find other ways of trying to deal with that illness that doesn't mean you need to wait in A&E for prolonged periods. Accessing things like 111, your GP, or a pharmacy. We've got excellent pharmacists that can do a lot more than you think that they can do. So trying to access those would help us immensely and help us protect our patients.